In most cities across the U.S., the mental health crisis is on the rise, and it's no different here in the City of Chamblee. That's why we're tackling this issue with a different approach, focused on de-escalating mental health interactions with our police. Changes at the state level have increased options in police response to people with mental health conditions or in crisis. The City of Chamblee is committed to using these new options to ensure that our residents are provided with the care and support that they need.
As part of our commitment to addressing mental health, we've hired a co-responder as a full-time staff member. This person is a trained mental health care professional that assists with crisis response and is dispatched alongside with our police officers. The co-responder also provides case management and following up after an incident and working to connect people with resources.
Under state law, there are 4 options for responding to someone who may be experiencing a mental health crisis. First, the person can accept voluntary transport to a care facility. In very severe cases, a person may be involuntarily committed for a mental health assessment. This is done with approval by a physician and only takes place if there is a concern about the person's safety or the safety of those around them. If the person has acted in violation of a law, but the officer believes them to be experiencing mental health challenges, officers have the option to transport them to mental health receiving facility instead of jail. The newest option available to officers was approved through the state last year. Officers now have the option to transport someone experiencing mental distress without an underlying offense. Our police work with me to assess and de-escalate the situation. I provide on-site support for someone who might be experiencing mental distress and then connect them with the right resources and care. I also manage follow-ups to ensure that they are connected with ongoing support.
Having this option to respond to people experiencing a mental health crisis has made a big difference for our officers. Working with a co-responder has increased the effectiveness of de-escalating tense situations and leads to better outcomes when people are able to connect with the type of help that they need.
If you or someone you know is experiencing a mental health crisis, it is important that you call 911 and mention to the dispatcher that you might need a co-responder to assist in the situation. You can also dial 988 to reach the Suicide Crisis Hotline as an additional resource that is available 24/7.
For more information on our co-responder program, please visit chambleega.com. We hope you'll join us in this new approach to mental health and safety in Chamblee.